And with that in mind, we do have Gina, our friend from the John Stoddard Cancer Center, joining us because October, very important month.
Yes, Breast Cancer Awareness Month this month.
And what are we doing to make sure people are aware of this?
Lots of stuff you'll hear in the news, of course. Our big push, of course, is always letting women know that they need to be getting their yearly mammograms done starting at age 40. We also have providers that need to be doing clinical breast exams every 2 to 3 years starting at ages between 20 and 30s, and then on up to 40. Then at age 40 it starts yearly, and then women should be examining their own breasts periodically just to make sure no changes are taking place.
Where are we in the battle with breast cancer?
We're making good strides. Lots of new treatment options are out there, and then I think the big push is always prevention. There's a lot more that has come out about, diet and exercise and just things we can do overall with preventing cancer.
Are we still finding that women are discovering that they have breast cancer at a younger and younger age?
That can happen, yeah. A lot of times that happens more often like in hereditary type instances. Hereditary cancers, though, in breast cancer only happen about 5 to 10% of the time, so not as common as people might think.
Now, speaking about being common and uncommon, of course, we're talking about women's breast cancer issues, but guys are not in the free and clear of this either.
That's a good point.
That you have to make sure you keep this in mind, too.
Absolutely.
And how would a guy know if they might have something going on?
Same as a woman. It's a lump just under the surface, basically, in the breast
Would it
area.
be in the middle, on the side? Where
it
would
could be really anywhere.
Really?
Yeah, really anywhere within that area.
So if something is unusual.
Yep, exactly, and that's the big thing. That's why it's important to periodically, check yourself just to make sure that you can't track changes unless you know what normal is for you.
I don't mean to throw curveball questions at you, but if you find it early, what's the survival rate? I'm assuming it's much higher.
It is much higher. I don't know percentages and that sort of thing, but yes, it is much higher the earlier you can detect any kind of cancer. So when you can find it at a smaller stage, you can have more treatment options and maybe not have as invasive of treatment options that you have to go through.
Well, we talked earlier with Dr. Cherney. One of the things we talked about before the segment was the fact that there was this perception that when you get the mammogram done that there's radiation, and so people were avoiding it because of that, but this is a low
It's very low
dose.
Yeah, it's like having an x-ray done.
Is it still uncomfortable?
It's still uncomfortable.
Okay.
Yeah, they have to really squeeze the breast just to see through all of that dense tissue. It's a lot of fat in there, and different glands and stuff that are in there, so they have to get a good picture by squeezing it.
Speaking of mammograms, when it comes to be that certain time of a person's life when a mammogram has to be done, there are some people that might not have insurance to cover this. That might be maybe have insurance, but it doesn't cover that portion of it.
Correct.
But you guys are doing something about that.
Yes, we are. So we have our Pink Saturday coming up, October 24th, and that's part of our bigger Pink Days program that runs year-round. And so with that, women who are age 40 and over, who are uninsured or underinsured, or who meet financial criteria, and that is being less than 250% below the federal poverty guidelines, can qualify to get a free mammogram. We partner with an organization called Bras for the Cause. They provide the funding for the mammograms, and then we partner with Iowa Lutheran Hospital and Iowa Radiology to get these mammograms done. So there's lots of women out there too who really can't get away from work. They might work very strict, Monday through Friday, can't get away to get a mammogram. So that's the idea behind this Saturday.
That's perfect. So that's the 24th.
October 24th, yes. And they can register on our website or call our phone number, 241-4141, to register.
How long does the process take? Being a guy, I have no idea.
As far as getting a mammogram done, just maybe 10 minutes or so that you're in there. I mean, it's a really quick
Not a big
in
time
and out.
commitment.
No, not at all. Just like getting an x-ray, basically.
Wonderful. So how do you get involved? How do you sign up? How do you?
On our website, or they can call the phone number to our office and get signed up that way.
I know a lot of people are going to be hearing a lot about breast cancer this month. It is that time of year when we really press the issues, but if you could leave one message with our viewers this morning that are watching, what would it be when it comes to a subject like this?
Just be aware of your own body, and if anything feels at all funny to you, definitely get it checked out. Better to be safe than sorry.
No matter how small you might think it might be, just get it checked.
And in most cases it might be nothing, but in those cases where it is something, you surely want to catch it sooner rather than later.
And that's the best news of all, when it's nothing.
That's right, exactly. We like to hear that.
Wonderful. Gina, thank you so much.
You're welcome.